Are you perimenopausal and feeling more anxious, stressed out, maybe more impatient, overwhelmed? Well, it turns out 15 to 50% of women going through perimenopause experience anxiety in some form. Whether you've had anxiety early in your life or not, maybe this is a new thing, we're going to talk about it. Hi, my name is Dr. Carrie Jones. I'm a women's health and hormone expert. Hit that subscribe button. I know hormones can feel like herding cats, and I am here to help. Now, let's talk about anxiety. Anxiety is a super common symptom that can show up in perimenopause. And as I said, maybe you've been anxious or had anxiety, been diagnosed with anxiety before, and it's getting worse. Or maybe you would never have described yourself as an anxious person, and boom, out of nowhere, you're suddenly feeling anxious. You're feeling overwhelmed. You're feeling like you can't handle things the way that you used to. This happens because of the changes in hormones. Of course, everything is changing. Why wouldn't anxiety and the feelings that you feel when stress happens change at the same time? When we are going through these changes, progesterone starts to decline. So progesterone is made after ovulation, and we get really high levels of it. And when it breaks down, one of the breakdown products goes up to our brain and helps support calming aspects. Well, if you're not ovulating anymore, you're skipping periods, or you're just not making progesterone like you used to, that calming aspect goes way down. On top of that, estrogen, estradiol, also plays a role in a lot of those neurochemicals, the neurotransmitters that float around in our brain, such as serotonin, our feel-good hormone, and dopamine for motivation. So if our neurochemicals are a little or a lot imbalanced, guess what happens? We feel anxious. We feel more overwhelmed, more stressed out. Maybe we're quicker to snap. We're more irritable. The main hormone up there that I was talking about is GABA. GABA is our brake system. It is our inhibitory system. It calms things down. It says no. And what we can feel is that we don't handle stress like we used to. What we can feel is just that feeling, that overwhelmed feeling, that stress feeling, that anxious feeling. Again, maybe you're used to this and it's getting worse, or it could be quite surprising if you've never had anxiety and all of a sudden you hit your 40s or your 50s and you're feeling it. So what can you do? Well, we know it's these shift in hormones up and down that can be a big trigger for anxiety. So if you are a candidate for hormone therapy, and I have videos about different forms of hormone therapy that you can watch, definitely consider it. Talk to your healthcare practitioner because of the anxiety that's happening in your life. Talk to them about progesterone and estrogen as an option. Now, when it comes to progesterone in particular, it's the oral estrogen. It's the progesterone pill, the one that you swallow, that does the most to support that GABA, that brake system, that calm in the brain. Whereas estrogen can be a couple of different ways, and you still can get benefit. So you can have the patch or cream. Even the oral pill is sometimes an option for some women, just sort of depending. Now, let's say you're like, okay, I'm on therapy, or I'm not a candidate for therapy. Are there other options? Well, first and foremost, we always start with the foundations. I know I talk a lot about integrative medicine or functional medicine, but really it should be foundational medicine. So let's talk about caffeine and alcohol. Maybe you're getting more sensitive at this transition time. Maybe because you're tired and stressed, you've been relying a lot more on caffeine and alcohol than you used to. So time to take a good hard look. Are you having too much caffeine in your day? Or maybe are you becoming more sensitive to it compared to when you were younger? Same goes for alcohol. If you're noticing that on the days that you do have alcohol, the next day you're more anxious, time to cut it out or cut way back, depending what your goal is. We also want to talk about hydration. I know this sounds crazy, but hydration with electrolytes can also do a lot to help reduce anxiety for some women. Being dehydrated can trigger anxiety, just like being hangry can for some women. If blood sugar fluctuations are happening, that can trigger anxiety. Being dehydrated can trigger anxiety. So make sure you're hydrated with electrolytes. Make sure you're eating consistently, you're getting enough protein, you're getting your greens, your fruits, your vegetables, some fiber, right? Like we want to eat the rainbow, but maybe stop skipping meals. Maybe stop pushing it so much, especially if you can correlate it that, geez, when I do skip, when I do push too far, when I'm eating certain types of foods, that can make my anxiety worse. Now, I'm not saying it's the cause of your anxiety, but again, I'm just trying to reduce what makes it worse. Now, let's talk about stress and sleep. Now, I know sleep can be real difficult right now in perimenopause. So we're going to talk about supplements in a second. And of course, I've already mentioned hormones. Both can be really supportive for sleep, but the way you gear up to go to sleep is huge. So what are you doing before bed? Again, going back to alcohol, are you drinking before bed? Are you having caffeine too late in the day? Are you staying up late doing very stimulating things such as watching shows on TV or watching movies that are quite stimulating? Are you working? What are you doing before bed? Because we need to switch that to a wind down routine. We need to at least try to, 30 minutes to an hour. Can you drink some sort of chamomile or sleepy time tea? Can you read a book? Can you listen to soft music? Can you turn off some of your lights? What can we do to trigger the body? Like now we go to sleep. And I know it can feel like a giant pain because you used to sleep, no problem. You used to be able to hang out all night long, come home, fall asleep, and stay asleep. Unfortunately, in this transition, that like sleep schedule can be very messed up very easily. It becomes more sensitive. So we have to be really on par with our sleep. But then that also leads me to stress. What are you doing about your stress management? I find that a lot of women in this time of their life, this transition, are setting harder boundaries, saying no, standing up for themselves, getting mouthy on what they need. And by saying no, it helps to work on the nervous system. By setting boundaries, it works on the nervous system. And the nervous system is our system that responds to stress. So what are we doing to be happy? What are we doing to find joy? What are we doing to feel safe, to be in our community? So you can see if you don't feel safe and if you're not that happy and you're feeling always stressed out, that can lead to anxiety. Then you layer on insomnia and the snowball just keeps rolling. Now, I mentioned some supplements. You always want to talk to your healthcare practitioner about this, but there are some research supplements that might improve GABA, that brake system in your brain, have been shown to reduce anxiety. One of which is actually the supplement known as GABA. You can take GABA. GABA is a neurochemical in the brain that also comes as a supplement. Now, there is some argument as to whether GABA is effective or not, because GABA itself, as a neurochemical, is a big neurochemical. So some of the arguments are saying, well, GABA can't cross up into the brain. For some people, it can. For some people, like there is an ability to get some GABA up across the brain. But there is some other research that shows when you swallow GABA, the supplement, it tells your GI nervous system, called your gut nervous system, called the enteric nervous system, to go up and tell the brain nervous system, calm down. Let's make some GABA. Like let's have a brake system here. So for some people, the supplement GABA really does work wonders for them, even though I know itself is a large molecule and might not get entirely through up across what's called the blood-brain barrier up into the brain. Now, other people really like something called L-theanine. L-theanine also helps support the brake system. It stops the excitatory system to allow the brake system to do its job. So L-theanine is very common. You will see in stress products or in anxiety products on the shelf on the stores, because L-theanine is generally considered pretty safe and is calming. And for a lot of people who are feeling overwhelmed and stressed out, L-theanine can be a great option. Now, there are a couple of herbs that may do well and have been studied for stress and anxiety. One is lemon balm. Yes, lemon balm, like the scented flavor that you might have as a soap or a lotion or a candle. Lemon balm you will often also find in calming teas or sleepy type teas, but you can find lemon balm in supplements as well. And the other one is known as passion flower. Who doesn't love the sound of passion flower? But passion flower has also been shown to have a very calming effect on the body. Now, if you're going to ingest lemon balm or passion flower, you do want to be careful because it might make you sleepy. So best to do late in the day before you go to bed, not before you're going to go on like a big road trip or something like that. You don't want to do that, or before you have to create a big report or like really focus on something. Lemon balm and passion flower, you definitely later in the day or whenever you're about to go to sleep. Now that leads me to magnesium, my favorite mineral in the whole wide world. And I do have a video all about magnesium. But the magnesium here, I'm talking about magnesium glycinate. And that has a glycine attached to it. And glycine is calming. Magnesium can also go up to the brain and be calming itself. So if you're maybe been talking to your practitioner about magnesium, or you've been reading about magnesium and you're thinking, I don't think I get enough magnesium in my diet or my day, ask your practitioner about magnesium glycinate. Consider watching my video and consider adding that in as well. Now, I'm going to rerun through these because I know it can feel like a lot. We have GABA, we have L-theanine, we have magnesium glycinate. I'm just going to throw that right there at the top. We have lemon balm, and we have passion flower. Plus, all the foundational things such as how much caffeine are you drinking? Are you hydrated? Are you eating? Are you hangry? Because we know hangry can trigger anger, but also anxiety. We talk about stress, sleep, boundaries, community, happiness, joy, and last, hormones. Estrogen and progesterone play a role in anxiety. Now, to round this all out, I also have a video on gut health and hormones. Yes, the health of your intestines can play a role in the health of your brain. So if your intestinal health isn't doing well, gas, bloating, heartburn, constipation, diarrhea, that can trigger inflammation in the brain, which can lead to anxiety because your GI tract, your intestines, talks to your brain through a particular nerve called the vagus nerve. So if the GI tract ain't happy, the brain ain't happy. And oftentimes anxiety is what can manifest for people. So watch that video as well. Now, I don't want this to be overwhelming. I don't want this video to bring you more anxiety, but I do want you to know that you can be very proactive about the anxiety or the overwhelm or the stressful feelings that you might have as you're making this perimenopausal transition. I want you to know there are researched back herbs and supplements, minerals, hormones that can make a difference. I also want you to know that you're not alone. You are not alone. If you've had anxiety before and it's back, or you've never had anxiety and it comes out of the blue, you're not alone. Remember, I said 15 to 50% of women develop anxiety during this transition. That is a huge percent. And again, you can be proactive about it. So talk with your healthcare practitioner, watch some of these other videos where I'm going to help educate you because I know hormones can feel like herding cats. So hit that like, hit that subscribe button, and of course, any comments, pop them below because we love to read them.